It might not feel like it now, but soon it will be time for kids to go back to school, so it's time to talk about vaccines. Mercedes checked in with a Southwest medical expert to learn more about the subject.
Vaccinations are so important, and I am joined by Chelsea Sandusky today with the Pediatrics Division at Southwest Medical. And Chelsea, why is it so important for us to vaccinate?
Vaccinations are vital to provide protective antibodies before we become exposed to particular diseases. It's always better to prevent diseases rather than dealing with any consequences, long-term sequelae, or treatment after having suffered the disease.
Has there been any sort of a return of preventable diseases?
Absolutely. Measles, believe it or not, was considered an eradicated disease in 2000. Whooping cough continues to have annual cases throughout the United States. And these diseases are highly preventable with the vaccine, but easily spread via aerosolized droplets. So some young infants are too young to receive the vaccinations, and some children may not be fully up to date on their boosters for the vaccinations based on their age. So that's why herd immunity, and we've heard that word herd immunity a lot recently, but that's why herd immunity is so important.
Let's talk about the vaccinations that children need. What are we looking at here?
Children that will be entering into preschool, kindergarten, and 7th grade will have standardized vaccinations that they require. The DTaP, the polio, MMR, and varicella will be required for entrance into the preschool and kindergarten programs. And then your Tdap booster and meningitis vaccinations are required for 7th grade.
Okay, so what are some of the risks that go with skipping or delaying your child's vaccinations or boosters?
Foregoing vaccinations altogether or delaying vaccinations really opens up that window of opportunity that your child might become exposed to one of these preventable diseases. Some vaccinations require up to 2 weeks to have full antibody response, and then other vaccines even require additional doses or boosters of the vaccine to really have that tip-top immunity. So delaying or foregoing vaccinations, really, you're kind of rolling the dice that your child might be able to be exposed, and then, of course, negatively affected if they contract the disease.
Now, I'm a parent, and what would you want me and other parents to know if we have concerns about bringing our kids in for appointments with their pediatrician?
What I would suggest to parents is calling your pediatrician's office and asking them, do you have any safety precautions, any protocols we can follow? A lot of times pediatric offices will be able to give you a particular date or time where the office may be less busy. That way to ensure more social distancing and ease any of those pandemic concerns. But bringing those children in is really important.
Southwest Medical Associates locations across southern Nevada. You can reach them and learn more about them. There's the phone number 702-877-5199 or go to smalv.com.